My name is Dr. Michael Streitmann. I'm a board-certified plastic surgeon with Westlake Dermatology in Houston, Texas at the Westview location. Today we're going to talk a little bit about blepharoplasty, which is commonly called an eyelid lift. So first we'll talk about the upper eyelid. Upper eyelids are easily done under local anesthesia, just using shots in the office, but can be done under general anesthesia as well if shots aren't your thing. The incision is unseen when the eyes are open. When the eyes are closed, you can see the little scar there. I use dissolvable sutures so they don't have to be removed. During the operation, skin, fat, and sometimes muscle are removed to debulk the eyelid and make it look thinner and tighter. Usually you can be back to full activities in 2 weeks. And it is, interestingly enough, now the most common cosmetic surgery that men get. So we'll look at a couple of pictures. This is a gentleman in his late 40s who had his upper eyelids done only. You can see on the preoperative picture that there is hooding of the upper eyelid, especially on the temple side of the eye. And then afterwards you can actually see the rim of the eyelid and the eyelashes quite well. And this is the side view. Once again, on the preoperative slide, you can see the hooding there, and then on the postoperative slide, you can see that the hooding has been removed. If you have any questions as we go along, you can submit them using the little Q&A icon on your screen. This woman is in her early 60s, and she had just upper eyelids done. This was done in the office under local anesthesia. You can see on the preoperative side, once again, the hooding isn't as bad as the previous gentleman, but it's still there. And that there's some puffiness near the nose on both sides of the upper eyelid. And then afterwards, that puffiness has been removed and the extra skin has been removed. This picture, the postoperative picture, is only about 6 weeks after surgery. The lower eyelid. The lower eyelids can be done under local or general anesthesia. The incision can be made on the outside of the eye through the skin, but I prefer to make the incision inside the eyelid where the incision is completely hidden. So there's no external scar at all with the way that I like to do my lower eyelids. Because the scar is on the inside, there are no sutures even needed. The incision inside the eye completely heals in about 24 hours. Through this incision, we can remove the fat pockets of the lower eyelid, and then you can return to full activities usually in about 2 weeks. So this lady is in her early 70s. On the left, you can see her preoperative picture. All she wanted done was her lower eyelids. She did not want her upper eyelids done. She had another procedure at the same time that was reconstructive in nature, but we also did her lower eyelids. And you can see on the after picture how her eyelid has much more contour and all the puffiness is gone. Here's the frontal view of the same patient. Even though she only had the lower eyelids done, you can see in her preoperative picture that there's puffiness and it looks like the opening of her eye is much smaller. And then after removing some of the bulk from the lower eyelids, you can see that it looks like her eyes are much more wide open. She could have had a better result if she would have done her uppers as well, but we did what she wanted and she got what she wanted. This is a younger patient, late 30s, had some puffiness of the lower eyelids and redundant skin of the upper eyelids. She had uppers and lowers done. And the postoperative picture you see is about 6 weeks after surgery. Another patient, late 30s, had her upper and lower eyelids done at the same time. You can see that the lowers are not near as poofy as they used to be. There's more definition to the lower eyelid, and there's more skin actually showing on the upper eyelid. A lot of times women complain that it's difficult for them to put on their makeup when they have the redundant skin of the upper eyelid. We're going to talk a little bit about brow lifting. It is often done in conjunction with eyelid surgery, especially in older folks. the eyebrow descending and dropping down the face produces even more redundant skin of the upper eyelid. So oftentimes this is needed to be done first during the same surgery, but we do the brow first, which kind of gets rid of about half of the upper eyelid skin usually, and then we take off the residual extra eyelid skin. Brow lifting can be done under local or general anesthesia, usually done under general. Like I said, it's often for older patients that have droopiness of the brow. The incisions are made at the hairline. That's where we remove the extra skin to pull the eyebrows upward. Sutures are usually removed in 7 to 10 days, or they can be completely dissolvable. Depends on how tight that incision is. And usually you can be back to full activities in 2 weeks. One thing to kind of keep in mind is if the eyebrows are already a little on the low side and you do an upper lid blepharoplasty, you will actually pull the eyebrows down a little bit. So that's one of the caveats of not doing the brow lift, is if you don't do it, your eyebrow might come down a little bit more. So this is an interesting patient. She's in her mid-30s, and all she had was her eyebrow lifted. You can see that she has extra skin of her upper eyelids in the preoperative picture, and the skin is actually resting on her eyelashes. So she had told me that this is the way she looked even as a youngster. So once the eyebrow has been lifted to the proper position, all that extra skin was pulled superiorly and no eyelid surgery was needed whatsoever. This is a woman in her early 50s. She had an eyebrow lift and an upper lid blepharoplasty. She also had some fat removed from her lower eyelids. Sometimes when the brow is low, it can give a person an angry appearance. In this case, people kept asking her if she was upset, was she angry? And she's like, no, I feel fine, I feel great. But it was because her brow was kind of in a downward position. And then when the brow is pulled up to a more natural position, then you look more refreshed and you kind of get rid of that angry look. This man here had a brow lift and upper eyelids done only. He has severe hooding on the temple side of his eye. And the crazy thing was this guy was a truck driver, so I don't know how he saw out of his side view mirrors. But after we did the brow lift and the upper eyelid blepharoplasty, he looks so much more refreshed. His eyes are open, and I'm sure his vision was probably improved as well. And here's the side view of that same person. You can see the severe hooding towards the temple side of the eye before, and then afterwards the hooding is much improved. Once again, mid-50s, upper eyelids, and a brow lift. And you can see that the brow hasn't been lifted tremendously high. It's lifted to a natural position. The only thing worse than having a brow that's too low is having a brow that's too high. I mean, it looks completely unnatural. So you want to have it lifted to a natural position. And then, like I said, you remove the extra skin of the upper eyelid once the brow has been lifted. This is an interesting patient as well. It is the same patient before and after. She's wearing her blue contact lenses in the after picture, but not in the before picture. So you can see the crinkling of her forehead. She is actually straining to keep her eyebrows up. If I would have been a little smarter, I would have asked her to relax her forehead when I took this picture, and her brow would have been even further downward. So in the after picture, now that the brow has been lifted, she's not straining to keep her eyebrows up, and the wrinkles in her forehead are much better. And then she had an upper lid blepharoplasty as well. So we have specials, and this was, I guess, the wrong slide. Sorry about that. That's my fault. The special is for October and November, not for May and June, and it's 10% off of the off the lower eyelids or uppers, 15% off all 4 eyelids, and if you throw in a brow lift, we do 20% off for those 3 operations. So if anyone has any questions, They can be submitted. We can answer them. Also listening in is Avery, our cosmetic consultant, who, if you can't get in touch with me, she will be happy to answer any questions. She works in our Austin location.
Okay, so Dr. Streitmann, I do have some questions for you. Let's see. What is the longevity after you have this done on the procedure? I think that means, like, how long will the results last?
Well, time will continue to tick away and will take its toll. But usually if you have an upper eyelid done, that's probably good for 12 to 15 years.
Awesome. What about how long does this procedure usually take? I guess some are going to be shorter than others.
Yes, upper eyelids are usually done under local anesthesia. In the office, that takes about 40 minutes, roughly. If you're doing uppers and lowers in the operating room, that's going to take about an hour and a half. And if you did uppers, lowers, and a brow lift in the operating room, that takes about 2 hours.
And can you go over again which ones would have to be done under general anesthesia and which don't have to?
The toughest one to do under local anesthesia is the lower eyelids, because once again, I make the incision inside the eyelid where it can't be seen. While that's being done, your eye is covered with a protective plastic shield. So I have done that particular operation under local anesthesia, but having the shield on and being awake and having someone tugging on your eyelid while they're doing the surgery, for me, I'm not that tough. I would go to sleep if it were me. But that's the one that's most commonly done under general anesthesia. Brow lifting can be done under local. Once again, a little more difficult than just a plain old upper eyelid, but upper eyelids are easily tolerable under local anesthesia.
Awesome. So does a patient need to wait a certain amount of time for surgery if they've had Botox around their eyes?
That doesn't make any difference. As a matter of fact, if you've had your 11s done for Botox, that actually makes the brow lift a little easier. Some surgeons will even give Botox prior to doing a brow lift, so those muscles aren't trying to pull your brow back down where it started. So it can actually be advantageous to have the Botox beforehand.
Okay, on that note, can a brow lift be used in lieu of quarterly appointments for Botox?
No, you really need to keep those muscles from contracting. So they work together, but yeah, the Botox is something you'll probably have to keep doing.
Do you offer these surgeries in San Antonio also?
We do the upper eyelids in San Antonio. If you're doing it under local, we do everything under local in San Antonio in the office. So if you can tolerate it under local anesthesia, we can provide the service.
And if not, we'll have a place for you here.
And if not, then we have other locations in Austin and Houston where this can be easily performed.
What is bruising like after each of these procedures?
It depends. I know that's a hem-haw kind of answer. If you're the kind of person that if you run into a countertop and get a huge bruise on your thigh, you're going to get big bruises around your eyes. If you're the person that doesn't bruise very badly, you shouldn't bruise very badly at all around the eyes. If you're a female, those little bruises can easily be covered with concealer if you get them. A little more difficult if you're a guy.
How much downtime can someone expect, if any?
For just a upper eyelid or lower eyelid, full activities in 2 weeks. Running, jumping, swimming, lifting weights, whatever you want to do. The brow, I'd probably wait for 3.
Okay. Let's see. There are a couple more questions coming in, and if anyone else wants to ask questions, we will have it open for about 2 more minutes. There are some questions on pricing. As far as pricing, I
can give you some general prices. Sometimes things are a little more complicated and it might cost a little bit more. especially if we're in the operating room a little bit more, or if someone's getting a revision procedure. But more or less, usually upper eyelids are 3,000, lower eyelids are 3,000. Doing them both at the same time is 6. And then with the brow lift, that's another 4. That does not include anesthesia and facility fees if you decide to go to sleep.
Oh, here's one. Does Medicare cover the procedure ever?
Medicare has clamped down on that. Now they have to be pre-authorized through Medicare. Sometimes, every now and again, they will be covered under Medicare to do the upper eyelids. The lower eyelids are never covered because there's no way that the lower eyelids can interfere with your vision. I've found that it's very difficult to get those things approved by Medicare now. They've really come down on people doing those because they were being done when they weren't really needed, and people were just basically getting cosmetic surgery off of their Medicare.
Would that be the same case for commercial insurance?
Exactly, even more stringent.
Got it. Okay. And then let's see. So for someone that lives alone, is it easy to do the aftercare at home if they live by themselves, or do they need to plan to have someone around to help?
If it's being done under local anesthesia, everything's fine. You can go home. If you're not taking any sedation while you're having local anesthesia, you can literally drive home. However, if you're going to sleep, you need to have somebody there the first night, I think, always as a precaution, even if you're super young and super healthy, because you never know if you might get up, you might trip, you might fall, you might faint while you're in the bathroom. I think it's always good to be with somebody that first night, no matter what your surgery is.
Great. Okay, so let's do one more question. Now this one's going to be a little relative. What would you say, Dr. Streitmann, is the pain on a scale from 1 to 10 comparatively, when you compare them to other plastic surgeries?
Upper eyelids is a breeze. I've done my own mother's upper eyelids. She never took a pain pill. I've done my own mother-in-law's upper eyelids. She never took a pain pill. The brow lift, you get a lot of numbness afterwards, especially up and around the hairline. So, I never give anything stronger than Tylenol number 3, just a little bit of codeine, and people always have pain medicine left over. The eyes can be a little irritated afterwards, especially if you're doing the lower eyelids. Sometimes I'll give steroid drops for that irritation, but as far as pain goes, this is probably one of your least painful cosmetic surgeries that you can choose.
Awesome. Okay, so Dr. Streitmann, do you just want to let them know about the specials again? And Avery, do you want to say hey?
Hi, I'm Avery. I'm a cosmetic consultant here. I work with Dr. Streitmann, and I'm happy to help anybody who has extra questions afterwards. You can email me or call me, and we'll provide you with that information as well.
Awesome. And then Dr. Streitmann, your specials for this month, not for May and June, but for this month.
For this month and next month, 10% off uppers and lowers, 15% off all 4 eyelids, 20% off for all 4 eyelids and a brow lift.
Awesome. Thanks, Dr. Streitmann.
Happy to do it. And this was Ashley here that was running the show. Thank you very much to her and to Avery as well.
All right. Thank you.
Bye, everyone.